I couldn't see very good at all through my right eye. It was very cloudy, smoky-like, and I didn't know where I was going to find a good doctor. My eye was just fantastic. This is one fabulous doctor. I could never say enough about him, truly.
I'd like to welcome Laguna Woods to my office. We help our patients maximize their vision and live their lives to the fullest.
The Orange County Eye Institute is a comprehensive eye care center. See well, live well.
Well, our medical topic today is brought to you by the Orange County Eye Institute, and today our topic is going to be glaucoma, and Dr. George Salib is joining us today with the Orange County Eye Center. Thanks for joining us today.
Thanks for having me.
Your topic today, glaucoma, that's a very popular topic in our community, and especially for the aging population. What is glaucoma really?
Well, glaucoma is an eye disease where the pressure of the eye, not the pressure of the body, affects the nerve of the eye that allows us to see. And that nerve gets damaged, and therefore you have a loss of your side vision or your peripheral vision. There's actually a picture of the eye over here on the right, and towards the right of the eye, that's the front of the eye, and the back of the eye is depicted on the left, and that tube on the back, that yellowish part, is the nerve of the eye, and that is the part that gets damaged in glaucoma, and that's the nerve that connects our eye to the brain. So
now, when you say it was damaged, is that just from age? Is it the elasticity that's kind of just wearing on it, or is it physical damage?
It's physical damage from the pressure of the eye in affecting the nerve, and that causes the loss of the side vision or your peripheral vision.
Now, when people are viewing, when they have this condition, it's somewhat like of a foggy, looking through a tunnel kind of scenario?
Yes, exactly. We call it tunnel vision. And what happens is, because you're losing your side vision, it kind of closes in on you until finally you have just a central portion where you're looking through, and it looks like you're looking through a tunnel. So you're losing a lot of that side vision. So for instance, if you're trying to make a lane change when you're driving, it's dangerous.
Right. That was the first thing I was thinking of. So when people have glaucoma, and they go to get their driver's test, they probably can read the chart pretty well if they're focusing on it, but they won't be able to see the peripheral, which is so important when it comes to driving.
Exactly. In fact, people who have moderate to severe loss of their vision have a 4 times higher rate of having a car accident because of glaucoma. So they actually ask us to test visual field testing in a lot of patients for the driving test.
How common is glaucoma then?
It's actually quite common. It's one of the leading causes of blindness in the United States and in the world. About 2 million people over the age of 50 have glaucoma, and in the next 10 years, it's estimated that another million or so people will be added to that. The funny thing is, or the strange thing is that about half of the people who have glaucoma haven't even been diagnosed with it.
Wow.
Either because they haven't come in for an eye appointment, or they just don't know.
Right. So these people are probably just slowly, or maybe they don't even realize it, that they're slowly losing their peripheral, and eventually it leads to blindness?
Exactly, and that's the scary thing about glaucoma. Most people don't know they're getting or developing glaucoma. In fact, you can lose half of the tissue in your nerve before you start to have any noticeable change in your visual field. You could see on the screen there's a normal nerve on the left, and then there's a glaucomatous nerve on the right. The normal one has a healthy kind of tissue. That's that circle in there, that pink circle with a white circle in the middle. And that pink area is nice and thick, and that's for a normal nerve. Whereas on the right, you could see there's some thinning here, which is the nerve damage that you see in glaucoma.
And it looks like the blood flow isn't nearly as good either, obviously, in the glaucoma eye.
Well, that's quite possible, because it's been shown to, for instance, be associated with conditions such as diabetes or high blood pressure. Although those haven't been shown to actually cause glaucoma, they are more commonly associated with it. So blood flow is one of the possible causes of glaucoma, although they're looking into all the different causes. No one really knows what causes glaucoma.
Oh, really? Does it affect a certain gender or race more so than others?
Well, it's thought to affect women more commonly, and also in terms of races, it's been found to affect African Americans and those of Hispanic descent more commonly. And also, those of Asian descent tend to have a certain type of glaucoma called narrow angle glaucoma. But it affects everyone from kids to adults.
So what kind of treatments are available for glaucoma?
There's lots of different ways that you can treat glaucoma. For instance, we usually like to start off with some medications such as eye drops that either lower the pressure by decreasing the production of fluid or decreasing or increasing the amount of fluid that gets out of the eye. You can see here, this is the basic structure of the eye. The front of the eye is over here, the cornea, but fluid is produced on the left side here, comes towards the front, and through these arrows, you can see how they get out of the eye. So medications can be used to lower the pressure by decreasing the outflow, by decreasing the inflow of the fluid that is made in the eye, or increasing the outflow out of the eye. Other treatments include laser treatments, such as SLT or ALT. SLT stands for selective laser trabeculoplasty, and that's a very effective method. And that helps us to lower the pressure by attacking the area of the eye called the trabecular meshwork, which is the area that lets the fluid out.
Wow. Now this example is what we were talking about, where somebody that would be suffering from glaucoma, that's how they would see possibly their grandchildren.
Yeah, exactly. And you can see here, these are what we call visual field tests. On the upper left, the circle represents what we're able to see. The more white, the better. So the darker spots are where we're starting to lose vision. And then over here, you're losing more vision. And down on the far left, on the bottom there, you could see how that's where your tunnel vision comes out, and that's what you end up seeing.
Wow.
The kids, their face is fine, but everything else is dark.
Now, in the old days when you were treated with glaucoma, at least knowing some of the residents and volunteers, they talked about sandbags and peas, and the post-op was, somewhat painful and took a long time. With technology nowadays, I understand it's pretty much, it's a lot easier than it used to be, let's just say it that way.
Well, certainly technology is always advancing, and now with our treatments such as eye drops, which are quite effective, and they're coming out with more and more drops that work. Laser is quite effective. In fact, with that SLT laser I was talking about 87% of patients can minimize their use of drops just after having had that done. Other surgeries, such as what we call trabeculectomies or other shunt-type procedures, increase the fluid physically out of the eye by producing a channel that gets out of the eye. And most of that is outpatient.
Right. Now, you also are available to speak to clubs and organizations too, because obviously this is a topic we could go on for many hours.
Certainly.
But you do speak at certain clubs as well.
Yeah, I'd be happy to. A lot of patients, a lot of people have questions about eye diseases that we can't cover in just a few minutes. And so I'd be happy to go out and talk to places at no charge. I'm happy to do that. I like to get out in the community.
I know we have a visually impaired club, and they're very involved in this community, so that would be somebody obviously you could speak to.
Yeah, that'd be
Tell us
great.
a little bit about your background. What did you do for school, and you live in the area, I know that.
Yeah, I live in the area. I went to UCLA undergraduate. I went to my medical school at the University of Wisconsin medical school. I had a master's degree at Georgetown, and I did my training here at the county hospital, where I had a lot of experience.
Right.
Through a UCLA affiliated program. And then I went on to do a fellowship in cornea at Tulane University. And then I've been out in the area. I was working in the Valley at a huge clinic for about 8 years, and then I came down here for the last year or so.
Oh, great. You've had an interesting, travel to come to Orange County. So.
Yes, California is my home, and it's always
beautiful.
been, so I'm glad to be back.
Yeah.
I love it.
And speaking of California, we have such beautiful weather here. The sun, people don't realize what the damages the sun can cause to our eyes. You and I have brown eyes, people with fairer eyes. Everybody needs to take care of their eyes, especially when the sun, and then we have springtime and the summer coming. So wearing a baseball hat, those kind of things are still common sense things to do, right?
Exactly. For the eyes as well as the skin.
Right.
Wearing sunglasses with UV protection is always very helpful as well.
Very good. Well, we thank you for joining us today on our program. This is a story, this is the topic of glaucoma. Obviously, it affects millions of people throughout the world and people in our community. The Orange County Eye Institute, give them a call at 770-1322 for all your eye care needs, located real close to us, or go to ociinstitute.com. They're on the internet as well, so be sure and check out those two things. Thanks for joining us on the program
Thanks for
today.
having me.
Appreciate that. We'll be back with more of the Channel 6 News for this.
Dr. Salib did the lens replacement in my right eye. Since seeing Dr. Salib and having this procedure, I can now see my children's faces, my grandchildren's faces, and the clothes they're wearing much more clearly. I wasn't sure what to expect, but I see perfectly now.
We help our patients maximize their vision and live their lives to the fullest.
The Orange County Eye Institute is a comprehensive eye care center. We are specialists in cataract surgery, laser vision correction, dry eyes, glaucoma, and multifocal lens implants. See well, live well.